Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
The conversation surrounding knee replacement surgery grows more pertinent as our population ages, emphasizing how crucial it is to comprehend both its advantages and potential concerns. In order to make an informed decision regarding this life-changing treatment, it is imperative that patients and their families consider all of their alternatives for knee replacement techniques. So if you are thinking of knee replacement therapy to get rid of knee discomfort and regain your mobility, this session is especially for you. Welcome everyone. I'm Dr. Soumya Saluja from THIP Media, and this conversation will be extremely beneficial for anyone considering knee replacement as a therapeutic option and to guide you every step of the way, ensuring that you make the best choices for your health and well-being. We have with us Dr. Akshay M. Kantharaju. Dr. Akshay is an experienced orthopedic surgeon who currently practices at the renowned Apollo Hospital in Muscat. Dr. Akshay is widely regarded as a leading expert in the field of orthopedics and is committed to delivering the highest standard of care to his patients. Sir commenced his career as a senior resident at the Bangalore Medical College and Research Institute, where he gained valuable experience and developed his skills. He further enriched his expertise at Fortis Hospital and Vardhaman Mahavir Medical College and Safdarjung Hospital in Delhi. Moreover, Sir's specialization encompasses a wide spectrum of orthopedic procedures, including joint replacement surgeries, arthroscopic interventions, and intricate foot and ankle surgeries. Dr. Akshay, THIP Media welcomes you, sir.
Yeah, thank you.
Thank you so much for your time today, sir. And now, Dr. Akshay, knee replacement is becoming an essential therapeutic option for patients who are aging. So I'm going to start off this discussion by asking that which medical issues usually call for knee replacement surgery?
Thank you, and thanks for giving an opportunity to speak on some related topic related to orthopedic surgeries. See, knee replacement nowadays, the most important indication for the knee replacement surgery is the osteoarthritis, as everybody aware of it. What is osteoarthritis? It is a wear and tear of the knee joint. Okay. As let's talk of the main issue. As the age advances, the wear and tear of the knee joint increases. Means the fluid inside the knee joint as degeneratively decreases as the advanced age. The cartilage goes for destruction. So as the age advances, for example, depends on the ethnicity, depends on the genetic composition, depends on the individual, depends on the male or female. It might be 50, 70, 80. The age, the knee joint goes for wear and tear. It might be a early osteoarthritis, grade 1, grade 2, grade 3, grade 4. As the last advanced stages of osteoarthritis is a clear and real indication for the knee replacement surgery, and that is the main important indication for the knee replacement surgery. When the patient goes for, if the patient is not happy with the conservative measures, like in the early stages, like medications, with good physiotherapy, with PMO strengthening, and one or two nowadays indications of intra-articular injections. It may be in the form of steroids, or it may be in the form of viscose supplementation like hyaluronic acid. When all the conservative measures fails, the last and indicated the patient may need a better, and the last outcome is the total knee replacement. That is the first and the foremost important indication for the total knee replacement as the advancing age, and as I mentioned the causes. And in the early ages, the indications are different. Okay, which is very rarely until and unless indicated. Okay, when the patient has for the complete deformity because of post-traumatic, because of other medical issues which have made the patient, the knee joint completely completely destroyed. That is a separate, and it has to be clearly indicated when then only the young adults is indicated for total knee replacement. Otherwise, it is the older age and the indicated is the arthritic changes and the early late stages of arthritic or the late stages of wear and tear destroyed knee is the indication for the total knee replacement.
So you've just mentioned that the aging is probably the most important indication for for knee replacement surgery, what I understand. Okay, so I mean, these days you've just mentioned that once the conservative options patients do, that they've stopped they've stopped responding to those conservative options, so probably they go on for the knee replacement surgery. So now, what I see these days is that knee replacement has become increasingly prevalent, the surgical option. So, what factors are driving this growth? Is it the heightened patient awareness or a decline in their overall health?
It's a right question because it has to be discussed in both the ways. Okay,
Right.
it can be a single scenario. It has to be discussed. For example, one particular half of the question because of increased awareness, because of the increased infrastructure and the increased advanced technology. Since
Right.
last the knee replacement is a well-known surgery since two decades or 3 decades, but the patients were not that much aware. Patients were not that much not knowing the results of the knee replacement surgeries, and they were not aware, especially in the countries like India, where we have not come the incomplete scenario of this knee replacement. Because of the present scenario, because of the present medical modern technology, and we are almost heading towards the almost replacing the knee replacement with a robotic knee replacement now. That is the advance. So the present scenario is driving the more information and giving a reach to the patient. So that is pulling the patient towards the knee replacement. That is one of the factor, and that is the one of the main factor which is driving the patient. Second is with respect to individual or with respect to the patient. Okay, because of our modernized society where the lifestyle has been completely modified, as when we discuss about with the other medical condition, even our health scenarios is getting destroyed. For example, obesity is one of the main factor for the early onset of osteoarthritic changes. Okay, one of the main and other and there is no clinically clear relating diabetes issue with the osteoarthritis. Okay, but the important factors are the obesity and the lack of exercises, lack of physical maintenance, lack of not having a good strengthening of the knee, lack of all these factors, all these things has been lead to the increased prevalence or increased onset of osteoarthritis in the early stages. Okay, the modernization. And the third thing is some of the other factors like increased sports injury. Before the sports injuries, when we go for a meniscal injuries, when we go for a ligament reconstruction, there is always a scenario where there is an early onset of arthritic changes compared to normal individuals. So obviously both the points are giving a combining and making a more prevalent, more incidence of arthritis, which leads to knee replacement surgeries to go on.
Okay. So, what is the level of complexity associated with this knee replacement surgery? I mean, before selecting a doctor or a hospital for a surgery, what are the general factors that a patient should consider?
Yeah, with respect to this, I will have to speak in in part by part. Okay, first one is what is the complexity of the surgery? You need replacement surgery. Then, for example, let's go from one by one. Knee replacement surgery is having two parts. One is partial knee replacement. One is total knee replacement. For example, partial knee replacement is less invasive surgery compared to total knee replacement surgery. Even the word itself signifies it. Okay, partial, Second thing, there is always a fear before that it is a big surgery where the entire knee joint will be removed, how they will remove. This is all the myths and all which supposed to be there. Okay, what I can't put is as a minor surgery. Knee replacement is a major surgery, of course. Okay,
Right.
it's a major because it is not a camera surgery. It is an open surgery. Okay,
Right.
where we replace the components of the bone and the things and all. But
Right.
because of newer technology, newer methodology of operating, the surgery has become less invasive because it is wider now with minimal incision, small incisions, minimal blood loss with under use of tourniquet control. And nowadays, rope has made this precise what cuts and all. So we can keep it as moderate surgery. Okay,
Right.
not as a so should not keep the word as complex surgery. It is a surgery which has to be done and which the patient is demanding. Okay, and it's a medium, not to worry about it, not to worry. Because it is an elective surgery. By elective surgery means patient will be evaluated. I am talking in a universal, generally everywhere the protocol is the same, almost are the same. It is always evaluated in detail. Okay, once the patient is fit for the surgery, then only the plan for the surgery will be done.
Right.
Okay. Then coming on to the how to select the doctor, how to select the hospital. My scenario, it is not to select the hospital, it is to select the doctor. Always. And even the patient will always think of a doctor, never the hospital. Always it goes parallelly. Where the hospital is there, where the doctor will be there. That's the second issue. Okay. See, any orthopedic surgeon who is having trained replacement, who is doing an active is a fair enough to go under, because I can't keep it as what is the criteria for a doctor to do a sound. So it is a general criteria that an orthopedic surgeon with a well-trained hands-on knee replacement surgeries is a doctor to consider to go for a knee replacement surgery with as per the convenience of the hospital. And nowadays it is almost reaching in every corner of the cities. Okay, even the knee replacement surgery is widely performed in. Before it was only the tertiary care or the metropolitan city. It is now it is at the two-tier city also, and almost at the basic structure also knee replacement surgery is going to be done.
Okay. So, though I'm sure it varies from case to case now. Now, what is the maximum age at which a person can opt for knee replacement surgery? I mean, is it possible for someone in their, let's say, late 70s or 80s with health conditions such as diabetes or high blood pressure to undergo this therapeutic option?
Yeah, see, rather than demarcating as there is no studies, there is no clear criteria. This is the age patient has to go for knee replacement surgery. Once patient demands, one patient is fit for the surgery. These are very two important. Irrespective of the age, the patient can go for a knee replacement surgery. Because individual to individual, the physical quality is different. The mind is different, the activity and the purpose is different. So, in general, if we are doing a knee replacement surgery, the most of the population now falls in 50, 60, 70, 75 till 80. The population is going for knee replacement surgery. In some scenarios, some sectors, people have undergone knee replacement at 90, 92 also. Okay. But it depends on individual. Okay, you should not streamline or compare between the person. Okay, but the more majority of the ideally the we can select the candidates, or the patient goes into that age will be 50, 60, 70, 70 plus is the sector. Okay, but again it is depends on the individual. But early age group usually won't recommend, or not required. No, that is the thing. But until and unless it is clearly mentioned needed, then only. So late, you can think of 70, 80 as the present scenario. Okay, but there is no clear cut indication.
Okay. So you've just mentioned about the physical fitness of the patient and not really their age group, right? So it's also, let's not consider the upper or the lower limits of these age groups. I'm simply going to ask that does this aging factor, or let's say the grades of your arthritis, does it affect the recovery phase of the patient?
Usually the recovery phase of the thing is depends mainly on the individual. Okay, there is
Okay.
not if the patient is fit, if that's so and so, we evaluate before only. That
Okay.
is the very important criteria. We evaluate the patient before only for selecting the things. Okay.
Okay.
Second thing is if the patient see what comorbidities are what very important for the general condition of the health.
Okay.
Second thing is physical activity and to mobilization of the patient. Okay,
Right.
usually if you do a knee replacement, why you are doing a knee replacement is very important. You are giving
Okay.
but the main important complaint why the patient comes to us is the pain.
Okay.
Okay, it doesn't come to me, it is gone for grade 2, it has gone to grade 3, you make it grade 0. The patient comes to me with the pain. Okay, second thing
Right.
is pain for more years, and see my bones are getting different shape also. Okay, it is
Okay.
coming in. So these are the things with the patient presents, and we are correcting those things with the knee replacement surgery.
Okay.
And if we have done a good knee replacement surgery, okay, means
Right.
a technically good knee replacement surgery, with second, with good mobilization and physiotherapy for the first few weeks, which is very important. Usually
Mhm.
the patient response is very super. Okay.
Right.
Okay, he
Right.
will tell depending on his old performance. He will always tell that I am recovering. I am able to do my activities which
Right.
are supposed to do for his age and his regular routine.
Okay. So you've just mentioned that the recovery phase is particularly very, very individualistic and
Uh,
depends on the stage of the condition at which the patient would report to the doctor.
Okay, and one very important point is that usually any surgery, usually 90% of the knee replacement surgery, next day or one within 24 hours or within 1 or 2 days, within one day usually, in our scenario, everybody in generally, the patient will be taken out of the bed, will be start walking. Okay, there is
Okay.
nothing
Okay.
as bedridden, you do the surgery, you make the patient for 1 week to not, no. Today you do the surgery, if he is
Right.
okay, evening only he will walk, especially.
Right.
If the
Right.
patient is going for partial knee replacement, majority of the hospital will send the patient by evening to home also.
Okay.
Okay. And what
Okay.
I'm trying to say is next first 2-3 weeks or 4 weeks, if he has done
Mhm.
a good physical physiotherapy with good strengthening exercises, and all, the outcome is good in the
Okay.
future. That is what
Right.
my thinking.
Okay. Right. So normally, do people always require replacement surgery or knee replacement surgery for both their knees? I mean, if one of their knees is damaged, is it likely that the other one will also deteriorate soon?
Yeah, see, the important thing is it is called as what is the condition which we are talking is the osteoarthritis. Osteoarthritis means degenerative, means it is a
Right.
wear, it is not a disease. Okay,
Okay.
it is for everybody. Okay,
Right.
everybody. Depends on the state, depends on the presence. Okay,
Right.
when patients start having the what knee or pain over the one side of the knee. Okay, to combat that pain, the patient will put more weight on the opposite.
Okay.
Okay, that is the main thing why the patient will again start getting the opposite knee is also affected. Okay,
Okay. Right.
so the usually this condition goes parallelly together. Okay,
Okay.
sometimes one knee will burst very soon, and the second knee
Okay.
will burst late. Okay,
Right.
that's the only simple scenario. So the
Okay.
patient will tell the simple words. He will tell, I am starting having pain both the knees, and right knee is more pain. Nowadays, I am getting more severe pain in the right side compared to left side.
Okay.
That is the words. So when he does that one in the initial scenario, when we are doing a medical management physiotherapy, at that time subconsciously patient will put more on the normal, So at that
Okay.
time it will have the arthritic changes of the second one also. So when over the period of time, when you do a knee replacement surgery for the first ones, the important knee which is disturbing him or her, the later the patient will consider for the opposite knee also. Why? Because this becomes right again. Now the disease in the knee has to be corrected. This is how the presentation and how we evaluate also. If it together presents in a completely radiologically and clinically both are knee are placed, it is ideally to go for a bilateral knee replacement surgery once at a time.
Okay. So it's just like one complete surgery involving both the knees.
Yeah. One complete surgery together, both at a knee, one side. Because one time anesthesia before literature used to tell one by one. Nowadays, it is not. Your patient is indicated, and if it required, okay, rather than do it, you finish it up one go and finish it up. That's the truth.
Okay, right. So if one person would want to go for a knee replacement surgery, like if a patient has been indicated for getting the replacement surgery on both the knees, and you would recommend the patient to go one knee at a time. So what should be the duration between the two surgeries? And what are the precautions the patient should take, between the recovery period of the two?
Okay, this is very simple. Very simple. If you are planning for a stage, for example, patient tells I want to go for the one, and I would like to see. But for example, if it is both damaged and needed, but patient wants to go one by one. For
Okay.
example, do the surgery, get the surgery done, and do the good physiotherapy. Before it used to be 3 months, 4 months before one and one. Nowadays, it is no need to. There is no until and unless the patient is okay with the surgery, patient is medically fit, no issues from him. You can consider within 1 month also. Okay, for the next. There is no strict protocol between any special precautions to be taken for anything because one surgery is done. You do the physiotherapy, you know the recovery phase, you have to do the exercises and you have to take care of it. Because there is no extra the things which has to be done by the doctor.
Right.
Okay.
Right.
The only which a patient has to take care is a good physiotherapy or a good strengthening exercises in the initial phase. There is no specific time duration between two as per the guidelines. There is no. Nowadays, we can depend on the individual. We can because when we are doing together two at a time, there is no guidelines. No? One by one. So how the individual of the patient, individual perspective, we have to consider. 1 month, I prefer 1 month. It can be a short or it can be a long. As if you want to go slowly, 3 months would be ideal.
Okay. Right. And so one very important question is that what is the failure rate in a replacement surgery? And what are the
Failure.
common causes for the failure? And if yes, then what are the options available if the knee replacement surgery fails?
Okay. For that, for example, any surgery has its complication. It is not called as a failure. Which I would
Okay.
not put it as a failure. It is the complications. Okay.
Right.
Any surgery complications as everybody aware of it because if you go for a single just injection for internet, it has its own complication. In the same
Right.
spectrum, knee replacement surgery is also having complications in some percentages. For example, infection we can get a knee because it's a major surgery. There might be chances. That is one complication, okay, which we commonly encounter. But we give we'll take care of that with antibiotic coverage and all. If it happens, it is hardly 2% chance. Second thing is there is chances in the over a period of time there may be loosening of the implant. There might be implant. Okay, implant
failure.
implant failure. That depends on that depends on many aspects. Okay, that depends you should not tell it that this is an implant. Okay. There might be loosening. You see, that depends on many factors. Like it depends on the number of years after the surgery has been done. So, for example, one example to consider. If it happens, there is always a revision surgery.
Okay.
Okay, so total knee replacement, the implant has failed, so doesn't mean that the end of the story. There is something called as to remove the implant, we have to get one revision. Nowadays, it is always we are at the second stage. Okay,
Okay.
revision to knee replacement. Primary is almost we going at the discussion of we are doing a revision total knee replacement. Okay.
Okay.
So no need to worry for it will fail or something like that. What surgery has its minor complication that has a solution. Okay, and it is for everybody and universal.
Right. Okay. So I think that was wonderful and very insightful, sir. Thank you so much for joining us today. Your presence is greatly appreciated, and we hope that the information you shared will be useful for many families. Thank you so much.
Thank you so much. Thank you so much for giving opportunity to see total knee
Thank you.
replacement.
Thank you so much, sir. Thank you. And for more such informative videos, please subscribe to our channel and press the bell icon for regular updates. Thank you once again, sir.